All right, everyone. Hello, everyone. Welcome to another exciting episode of Prestigious Talk Show. Today, we have a special guest with us. Yes, we have Dr. Osasu live with us on Prestigious Talk Show. Dr. Osasu, you're welcome to Prestigious Talk Show.
Thank you so much, and it's my pleasure to be a recurring guest here. Um, as you said, my name is Dr. Osasu Asemota. I
Yes.
am a board certified obstetrician and gynecologist, or OBGYN for short, and I'll be
Yeah.
talking to you guys today about menopause and age related fertility.
Yes, so today Dr. Sasu is going to be educating us, and she's going to be educating us on the issue of menopause and having. Um, we are going to be talking about childbearing at the late age. So today, viewers, we want you to join us live. If you have any questions, if you have anything that you want us to talk about, please feel free to comments down below, and of course I'll read it out and Dr. Sasu will be able to answer your question. And before then, we would like to go on a few seconds break. Okay, so please you stay tuned, and let's go on break now. We are just going to go on a few seconds break. Stay tuned. Okay, 1 second. I'm still okay, viewers. We'll be right back. Okay, listen to us. As I said, we have so many. A 2 year program, if it's a 4 year program. Yes, we have so it's wrong to ask you about it. What should I do? 3 years he has tied you down and he has not completely, just it's just all right, viewers, welcome back. Welcome back to Prestigious Talk Show. Yes, we are live here with us is Dr. Sasu. Please stay tuned.
And watch Prestigious Talk Show.
Okay, viewers, welcome back. We are live here on Prestigious Talk Show. Live here with me is Dr. Osasu Asemota. Viewers, if you have any question today, please be ready to ask her, and she's willing to answer your question today. So, Dr. Osasu, you're welcome back to Prestigious Talk Show.
Thank you
Welcome
so much.
once again. Yes, we are glad to actually have you back. Last year, summer, I believe, you were with us,
Yeah.
right? Yes, so welcome back once again. And we have different questions because last year when you came, a lot of people they inboxed me, they were asking me questions. I even some sent me a message, which I of course did message you back, and you were able to actually answer those questions. We really appreciate that. But this our topic for today is about menopause and childbearing, having children at a late age. We'll talk about the implications today, and we'll talk about the issue of menopause and why women are mostly ashamed to talk about menopause when they are experiencing menopause. So today we are just going to talk about having children at a late age, some of the implications. So one of the questions we have today for you is: do you think from 34 to 40 is too old to have a baby? So we want you to educate us on that, because you are a gynecologist and of course you are an expert in that line. So yeah.
Yeah, absolutely. So at 34, no, it's not necessarily too old to have a baby, but advanced maternal age, or an age where you'd be considered high risk pregnancies solely due to age, is from 35 years and above.
Okay.
So if we shorten the range a little bit from 35 to 40, you would be considered advanced maternal age.
Yeah.
And the reason being is because there's an increased risk of genetic disorders, which we'll talk about later on in the show,
Yeah.
um, as well as an increased rate of it being an abnormal pregnancy.
Yes. Okay, so that is when you're over 34 to 40. So there's this
35 to 40.
35, yeah, 35 to
Mhm.
40. So there's this risk, right, to
Yes,
have abnormal pregnancy or not having baby at all, right? So
right.
let me see. We have somebody commented. Let me see. Okay, hi. Alero said hello. Hi, how are you? Thank you for joining us. Okay, so we have another question for Dr. Sasu. So if you have any question that you want to, if you want to talk about anything, Dr. Sasu is live here with us on Prestigious Talk Show. She's actually a gynecologist. Please, can you also tell our viewers your expertise, like your where you're mainly specialized
Oh
on?
yeah,
Yeah, please.
I'm a generalist, but I
Okay.
also do a lot of gynecological surgeries, which
Okay.
include myomectomies or removal of fibroids,
Mm-hmm.
DNC hysteroscopies, where we take a look on the inside of the uterus,
Mm-hmm.
specifically for abnormal bleeding,
Mm-hmm.
as well as hysterectomies when we take out the uterus.
Okay. So, okay, sure. So, viewers, if you have any question, please feel free to comment down below, and I will definitely read your questions to Dr. Sasu, please. So our next question today for Dr. Sasu is, because we have series of questions here that we really want her to educate us on. What are some of the implications of, yes, of course, I think you talked about some of the implications of really having baby late, because we see some women these days, they'll have babies at the age of 50, 55, 60, and yet their baby will
Mhm.
still be normal. Trust me.
Right,
So
right.
what are some of the implications of having baby late?
Yeah, so some of the implications specifically, again, about having babies late. Um, Number one, that it's becoming more normal. A
Mm-hmm.
lot more women are now pursuing careers or pursuing education before starting a family or expanding their family. Where traditionally it wasn't uncommon to
Yeah.
have kids like in probably your early 20s
Mm-hmm.
or even teens. But now a lot more women are pushing their childbearing years into their late 20s, early 30s, even upwards to early 40s. And like you
Mm-hmm.
said, there's some 50-year-old ladies
Yes.
that have pregnancies as well. Um, but I just wanted to to kind of give a comparison or a review about why it's considered advanced maternal age or high risk pregnancy
Mm-hmm.
secondary to age is because
Mm-hmm.
your fertility levels typically for of course when you're in your early 30s, so say about 32
Mm-hmm.
compared to when it's 25, like it decreases significantly. So for example, let's say that you have about a 10% risk of having a miscarriage
Yeah.
at 25. When you
Okay.
have a child at 30, you
Mm-hmm.
have an increased risk by 12%. So it's a
Oh.
2% difference. And then after the age of 35, it increases to about 18%. So if
Oh.
you're pregnant by the age of 35, that's an 18% chance that you will have a miscarriage. And of
Oh.
course, that almost doubles at 40s when you have a 34% chance of having a miscarriage if you are
Oh.
pregnant at the age of 40. So
Oh. Okay.
this strictly due to age. Also, we saw that there was an increased risk of Down syndrome or genetic abnormalities that are
Yes.
associated with older women as well. So, again,
Mm-hmm.
for example, at 25 years old, you have like a 1 in 1,000 chance of having a baby that has Down syndrome. At the age of 35, it increases almost 3 times or threefold at 1/374. So,
Oh.
that is another independent risks associated specifically with advanced maternal age or over the
So
age of 55.
so when you're like when your age is more than 30 or 35, you're prone to having a baby that is not normal, or you have a higher risk of having a miscarriage or
Yeah,
having a Down syndrome baby, which means it's
correct.
just kind of 50-50 in that case, right? Of having,
Yeah, exactly. So the risk increases almost 3 times
oh wow. So
compared to
wow.
when you're 25.
Yeah.
Yeah.
Yeah. So in previously, I think I have met somebody that was, you said 1%. I have met a young lady that actually, I think she was in her 20s, mid 20s. She has a baby, her first child, Down syndrome baby. So, what can you explain to us why most young women, young somebody that is young, will not have a child with Down syndrome? What is the cause of that?
Yeah. So yeah, there's, even though it's a low chance, there's still that possibility. So unless, for example, she had her own predisposition through her family lineage, that's usually the most common way,
Mhm.
that or common trend that we would see, genetic abnormalities even in a very young woman
Mhm.
that for any other reason shouldn't have any risk factors. But
Mhm.
yeah, that's usually one of the things that I would first think about if there's a family history of mental disorder.
Yeah, I was going to ask that, is it something that is hereditary, or it
Mhm.
has to do with the family? So that was what I was going to ask
Yeah,
you. Yeah.
for the
Okay.
most part, again, specifically with Down syndrome, it's kind of a spontaneous
Mhm.
miscarriage. But of course, if you have a family history of a mental disorder, I'm sorry, of a intellectual disability disorder, then
Yeah.
you have a chance of developing that yourself.
Okay. Thank you very much. I have somebody ask me here. He said, "Is normal delivery safe for a 44-year-old?" Yeah, that's the question that was asked here. Please, can you answer that?
I'm sorry, can you repeat the
He
question?
said, "Is normal delivery safe for a 44-year-old woman?" Normal delivery.
Yes, yeah. So vaginal delivery, despite some of the negative connotations that OBGYNs is preferred, it is
Mhm.
preferred and it's safest for both mommy and baby to have a
Mhm.
vaginal delivery. So again, unless there's no reason or contraindication for having a vaginal delivery, then it's definitely safe and preferred.
Okay, so a 44-year-old woman can actually have a vaginal delivery, not operation, right?
Right, right.
Okay, okay. Thank you very much. So I think, Alero, you just asked that question. Thank you for asking that question. We'll be right back. We're just quickly going to go on a few seconds break. We have live here with us, Dr. Osasu, but we are going to be back in a few seconds. Stay tuned with us. Thank you.
And watch prestigious talk show.
So welcome back, everyone. I have live here with me, Dr. Osasu Asemota. She's all the way from New York. She's a
Mhm.
gynecologist. If you're not here with us, please join us and share this video. She's here to educate us about having babies late, and also women that are experiencing menopause. She's going to tell us some of the symptoms of menopause and why you should not be ashamed when if you are experiencing a menopause. So, Dr. Sasu, welcome back to Prestigious Talk Show. So we just have a question again. Another question that I have for you is, for those, we have some women who really find it very challenging to have kids, and some of them don't even know that they have different means of, they have different options to have kids. What options, or what do you have to tell them? Because we have some women that can't have kids, they don't know that they can, exploit their options. What do
Mhm.
you have to tell them about the
Yeah.
options that they can explore?
Absolutely. So infertility is actually more common than people think. Up to
Mhm.
10% of all couples in the United States specifically may have difficulty having a baby or
Mhm.
becoming their family. And that's all across the board, all races, all ethnic groups as well.
Mhm.
So typically, again, in patients or in our ladies that are under the age of 35, it can
Mhm.
take up to a year of trying before you are advised to seek medical help.
Mhm.
So I always tell my ladies, especially when they're just beginning their journey, to be patient
Mhm.
with themselves, because again, it can take up to a year of trying before it's deemed necessary to seek
To
medical help.
Okay.
For ladies that are 35 and older, or 35 to 40, it's recommended to wait about 6 months of trying before seeking medical help. And for our ladies that are 40 years and above, we ask that you go to a reproductive endocrinologist immediately.
Okay. Oh, wow. Thank you very much. If you're watching us right now, Dr. Osasu just told you the options that you have. If you're 35 and older, you have to wait up to 6 months. If you're married and you're planning to have a baby right away and it's not forthcoming, after 6 months, you can seek the help of a gynecologist. Visit your gynecologist and they will tell you what options that you can explore in order for you to have a baby. But she said if you are 40, you have to go right away.
Right
Because
away.
right away, please, you have to run, meet your gynecologist. The chances of having babies is very, very slim. So Dr. Sasu is here to advise you. Please utilize this opportunity. She's live here with us. If I have money, I don't even think I'll be able to hire her. She's a medical doctor.
It's
She's a
free for you.
gynecologist. Yes. Thank you so much, honey, for honoring my invite. So thank you so much. So please, I want my viewers to use this opportunity. If you have any question, please use the opportunity to ask your question right now. And of course, you can comment down below and I will read it out. She will definitely answer you. And again, please share this video right now. If you want to help us by sharing this video because it's going to help one or two persons, please share this video because Dr. Sasu is live here with us. If you have any question, you have the opportunity to ask right now. Okay, I have somebody just asked a question. Let me read it out to you. So he said, some women in their 50s giving birth use IVF and the babies are normal than the women who are in their sorry, she said some women in their 50s giving birth use IVF and the babies are normal than the women who are in their 50s having higher risk of having babies with some complications. Yeah, can you tell us why? She's saying some women in their 50s who have IVF baby and the babies are normal. Then some women in their 50s, who we have a normal baby will have a higher risk and have some complications. Yeah, please.
Yeah, absolutely. So, one of the services that are available through reproductive endocrinology, again, that's a specialist that a GYN, OBGYN specialist that specializes in fertility, is the technologies that are available for them to really kind of increase their hands, so to speak. So, for example, they're able to genetically test the embryos to see if they're genetically normal. Again, and in patients that are considered advanced maternal age, that is increased risk of having a genetically abnormal baby compared to someone, for example, if they conceive naturally. And also, one thing to know also is to know that with age, your risk of miscarriage is also due to the baby most likely being genetically abnormal. So through these IVF services, they're able to select the embryos that are going to be genetically normal because they have a higher chance of them conceiving.
Okay. Thank you so much. I have a question here for you, Dr. Sasu. This is from Okoro Progress. Bua, she said, can a woman get pregnant during menopause period? Okay.
Yeah, so this is a good question, right? Because
yes.
Most of the time, if someone's like in their 50s, they're like not expecting to get pregnant, and then they do.
Yes.
So in North America, the average age for menopause is about 51. But there are some cases that ladies may have perimenopausal symptoms or changes in their late 30s, early 40s. Typically, if it's before 40, you may want to check for other genetic abnormalities, like Fragile X syndrome, for example. But around, on average, between 40, 44, 45, ladies may start experiencing perimenopausal symptoms, which includes abnormal bleeding, vaginal dryness, mood swings, hot flashes. So that can happen years before you actually go into actual menopause, right?
Yes.
Because I know a lot of my ladies come in, they having these symptoms for like 6 months.
We are going to talk about that a lot today.
think we're in menopause, but no, as long
Yes.
as you're having bleeding and as long as you had less than a year
Yeah.
from your last period, then you are considered fertile.
So you can have baby.
Yeah, you can have
Really?
babies in the
No.
perimenopause period.
So really, you can have baby when you are still in your premenopausal period.
Yes. Yeah.
No, don't tell me that.
It is still
That is
possible.
so. That is really
Mhm.
funny. That would be. Oh God, I don't know what they would call that baby. You think you're done before you know what is happening. You have a baby. That okay? Where are you coming from?
Yeah.
Okay, guys, the floor is open for you to ask questions. Please feel free to ask Dr. Osasu Asemota questions, please. Okay, she's here to actually answer your questions, and we are privileged to have her. I can't even emphasize this enough. I am privileged to have her live on my show. Yes, she respects me, and I respect her a lot. I love her so much. There is a young doctor. Oh my goodness, I'm proud of her. Edo girl, Bini girl, proud of you, girl. You are wonderful. She's doing amazingly. She has, in short, Dr. Osasu, tell us how many baby have you, you
Oh,
catching babies. Yeah, we want to know that.
we've been busy here in New
Yeah,
York. So I think COVID has really, been good for my business.
really? Oh,
Oh
really?
yeah, oh
So you
yeah,
mean the COVID period, you guys have been catching babies,
yeah.
delivering
This
babies?
past summer was very busy for me.
Okay,
A lot of
wow.
sleepless nights.
Women were
Again, I
busy,
love it, but it
busy.
definitely was evidence that there was a COVID boom.
Oh my goodness. Do you guys hear that? COVID boom babies. Oh my goodness. I think everybody they were, busy creating babies, making babies.
Hey,
Oh wow.
again, no
That's
business for me.
that's good. That's beautiful. I know you love your job. I know
Yeah.
you are passionate about what you do, and that is awesome. The fact that you're in the field of women, you're helping women, helping them bring help them to, I don't say, would I say bring life, help them to, um I don't have a word for it. Yeah, yeah, it's just something that is
Yeah,
awesome.
I help
Yeah,
them bring life and I help them
yeah,
take care of their own, right?
yes,
I
exactly. Yeah,
help
you care
with
for them throughout
depression,
the, yeah,
neuralize well woman health. So yeah,
yeah.
it's been my
Okay,
privilege really.
okay, so we are just going to quickly digress into our next question. Okay, now we are going to go into the menopause aspect. Of course, before I even start with the menopause, when somebody asked the question, so some women do. We talked about it a little bit. I just want to really ask you this question. Some women do experience menopause at the early age of 40 and up. What are the causes of early menopause experience for women?
Yeah. So yes, again, some of the symptoms of perimenopause again can occur as early as your early 30s to on average around 45. But one of the most common causes of early menopause syndrome is if you have some type of genetic abnormality, specifically Fragile X, if you have any uterine anomaly, or if there's any disorders in your uterus itself that could
Mm-hmm,
put you at a higher risk of having or developing abnormal menopausal or early menopausal symptoms.
mm-hmm.
And then it's just uh, interesting fact, whatever age your mother went into menopause might be the same age that you would go into menopause.
Oh,
Yeah.
really?
So daughters tend to follow the pattern of their
It's
mothers
like
when
a
it comes to
trajectory. Yeah. Okay.
yeah.
Okay. So because somebody told me that in their family, it is very common that most of the women in their family start their menopause at the early age of 35, 30. I was like, wow, that's really early,
Yeah.
right?
Yeah,
So
it is
what
early.
is the cause of that? That is really early, which
Yeah.
means you have to start giving birth at the age of what, 20, 18, or what? That
No,
is,
so
yeah,
again,
yeah,
before that was the case,
yeah,
and of course, as we know, teenage pregnancy,
yeah,
also an independent risk factor or
yeah.
for high risk pregnancy as well. But honestly, as soon as you have your first period, you are technically able to give birth.
Okay. So
Mhm.
I have a question here. Somebody said, Okoro Progress said, what is the remedy for heat heat flashes during menopause, like hot flashes, I think. Yeah. Yeah.
Yeah. Of course, I think if you are having these symptoms, you should see your GYN and kind of
Yeah.
see what's available. One of the most common things I know a lot of ladies ask me specifically are natural remedies. And there are certain things that you can take over the counter or at home to kind of
Mm-hmm.
help abate some of the most common symptoms from menopause, which is the hot
Mm-hmm.
flashes. I have a
Mm-hmm.
lot of ladies come to me that just wants uh, just the way we're able to wear one set of clothing throughout the day and not have to go through the four seasons in a day, right?
Mm-hmm.
So one of the things that you can add into your diet are soy products or tofu, vitamin E supplements daily has
Okay.
been shown to decrease hot flashes specifically. You can take ginseng tea, ginger,
Ginseng. Okay.
a Saint John wort, excuse me, and black cohosh. These are
Mm-hmm.
kind of like over-the-counter remedies or natural remedies to implement into your diet,
Mm-hmm.
into your daily routine to help abate some of the menopausal symptoms.
Okay. So I know that some people will say you can also um, take ice block, drink a
Yeah.
lot of hot water, use fan. And another thing, most women don't really talk about menopause. Is like something that they are ashamed to, talk about in public. Why do you think so? Why do you
Yeah.
think that is more common that women don't really share or discuss or talk about their menopausal experience?
hmm
Why?
Yeah. I think that society
Frown
has
upon it?
created, yeah,
Mhm.
there's a lot of female relevance in terms of beauty and
Mhm.
fertility, right?
Yeah,
You're
yeah.
most valuable when you're able to reproduce and to
Mhm.
be a muse of some sort, right?
Mhm.
So once a woman goes into menopause, it's kind of a relinquishing of that power, right? It's a relinquish of that association of their usefulness of their desire, and that can be
Mhm.
difficult to to handle and difficult to swallow and difficult to process. But it's a
Mhm.
natural process. Every woman will go through it at some
Mhm.
point. The journey is different for everybody, but it's also very similar.
Mhm. Okay. Okay, thank you for actually answering that because I feel like from what you said, most women actually feel like, okay, I will not have any usefulness again, not being able to produce anymore, which means something is not right with me, something is wrong, it's a shameful thing because you hardly see women talk about menopause. Not that they don't experience it, but they don't
Right.
want to share with anybody. And if you do share, there's a way your fellow woman will look at you, oh, you're already experiencing menopause. Like,
Mhm.
so for that, I feel like most women will just keep it. They will just hide it and just decide to go through the whole experience themselves. So the expectations of menopause, especially in our society, as you said, from 50 and above, and if you're not yet there and you're experiencing menopause, you share with
Right.
your cohorts, they will go like, wow, you're already experiencing menopause?
Yeah.
Whoa, they will just see you differently. So because
hmm
of that, you see most women in their 40s or mid 40s don't really want to share. They'll just keep it to themselves and just experience it in a very covert way. But there's nothing to be ashamed of. It is something that is natural, right? As you've said,
Absolutely.
rightly said.
It's a natural process. Everyone will go through it.
Yes, yes. So, viewers, if you have any question right now, it is your time to ask Dr. Osasu question. Please don't come and be asking me once she's please feel free to ask her any question. Please feel free to ask her question because I'm not a gynecologist. She's the expert. She is in this field. So if you have any question that is relating to your body right now, the expert is here. Dr. Osasu is here to answer your question. Please feel free to do so. And later we are going to talk about the history. I don't know how to pronounce it. And the one that they remove their womb or what I don't know how to
Yeah.
something is it hysterectomy? I don't know.
Hysterectomy. Yeah.
Hysterectomy, yes, yeah, we are going to talk about that too. Because for most women, after that, they will experience their menopause, right? So we'll be right back. We are going to quickly go on a few seconds break. Please, if you have any question before come back, make sure you comment down below and I'll read it out to Dr. Sasu. So stay tuned, we'll be right back. So we're talking about hysterectomy. Please, can you tell us about that? Because I know that most women, after the hysterectomy, they now experience menopause. Can you educate us a little bit about that, please?
Yeah. Well, again, this is so hysterectomy is one of the most common surgeries that are performed by OBGYNs.
Yes.
Um, hysterectomy itself is the removal of the uterus.
Yes.
A total hysterectomy, it includes the uterus and the cervix, what most gynecologists would use to perform a pap smear.
Mm-hmm.
Um, I think one of the most common misconceptions, though, is whether or not the ovaries are going to be removed with the uterus.
Hmm.
And that is a separate procedure. It's called a salpingo-oophorectomy, or the removal of the fallopian tube and ovaries.
Mm-hmm.
And so long as the ovaries are intact or left, you won't go into menopause. It's very, if you're not having any symptoms,
Hmm.
you may still produce estrogen until you go into natural menopause. So you can have a hysterectomy and have your ovaries left in place and still have menopause symptoms afterwards.
Oh, okay.
Yeah.
Okay. Yeah, somebody actually asked me that question. I decided to, add it to the question. One of the questions
Mhm.
I said I was going to ask you because she said she had a hysterectomy and, all her, of course, uterus was removed and now she's experiencing menopause. It was supposed to be like that. It was to fibroid, yes.
Mhm, mhm,
Although
mhm.
she had
Yeah.
kids already, yes, she had fibroid, and they advised her to just remove everything. And now she's experiencing
Okay.
this. So
Yeah.
that's why I asked you that question because she
Mhm.
actually sent me a message and said, "Please, can you ask the doctor that is coming this question?" I said, "Of course, I would definitely ask her."
Sure, sure.
So, yeah.
Yeah. So as long as your ovaries are left in place, then you won't go into menopause, even if you have your uterus removed.
Okay. So you
Mhm.
go into menopause, right?
Right. The
Oh,
removal of the ovaries will put you into menopause.
oh, wow. Okay. Good.
Mhm.
Okay. So I think that is why she's experiencing her menopause, yes, because she's less than 50, 45 or so. Yeah.
Mhm.
So she had the surgery done and they removed everything. I forgot what I told you that the operation she did just now was it fibroid, yeah, fibroid operation, yeah. So everything was removed and now she's experiencing menopause. Yeah, another question that I wanted to ask: does menopause reduce your bone density?
Yeah, so once the estrogen levels go down in your body, estrogen is also responsible for some component of bone health.
Yeah.
So if you go into menopause, it is suspected to be at an increased risk of decreased bone density or osteoporosis.
Wow. So how do you now? Oh, please, please. I am so. What do you now do if you're experiencing? What are some of the experience that if your bone density is low, how do you
Yeah.
figure it out? What are some of the
Yeah. So of course, prevention is is always better than the cure. ACOG or our American exceptions, the American College of Obstetrics and Gynecology, they actually recommend to include exercise, at least 150 minutes of aerobic exercise or high intensity exercise a week, and or 300 minutes per week of medium to low intensity aerobic exercise. So exercise has been prone to improve and sustain bone health. Another thing that we emphasize or encourage is to have weight bearing exercises. So light weights. It doesn't have to be like Arnold Schwarzenegger, but using like weights, 5, 10 pound dumbbells, or including a weight training or muscle strengthening exercise in your program has been shown to sustain or keep your bone density as well.
okay? Oh, good. So are there vitamins that they can also take for bone, to help them with the bone? Uh,
Yeah.
yeah.
So calcium and vitamin D as
Okay.
well, including that in it could be in any multivitamin, or you can take a separate additional supplements, has been
Okay.
shown to help with bone density.
Okay. Thank you so much for actually, yeah, because of that. Yeah, I have a question. Somebody just sent me a test. She just had a baby. She's worried about her. She had a vaginal baby few weeks ago, and she's worried about her vagina. How can she like bring her vagina back? Is there anything she can do to kind of
Yeah.
sent me a test right now? She says, is there anything she can do to bring her body back to normal in terms of
Mhm.
making sure that her body, because she said she had a tear, because her first baby, there was a tear, and she's feeling somewhat what weird about her body. What can she do in order to feel, normal again? You know,
I see, yeah.
herself.
Yeah, so congratulations to her. And yeah, it's
Yes,
not uncommon to um feel weird or go
yeah,
through a
okay.
healing process or even have a tear during a vaginal delivery.
Mhm.
Um, we would recommend like having um nice showers, of course. You can apply depending if you feel like it's swollen, you can apply
Mhm.
like an ice pack to the vaginal region and allow your time, your body to heal.
Mhm.
The vagina is a very, very forgiving, forgiving tissue.
Mhm.
So you'd be surprised, even about 3, 4 weeks out, the vagina pretty much is back to normal, or at
Oh,
least before you have the baby.
mhm. Okay. So thank you. I will definitely relate that. I'll tell her to watch this video and just get the feedback from you. So, anyways, viewers right now, if you have any questions, please feel free to comment down below, and Dr. Sasu will be here to answer your question. Okay, yeah, I have somebody sent a question. Oh, okay. Dr. Sasu, we have questions here from Malera. Said, can women go through menopause without knowing how it feels? Wow, I don't
Yeah.
really.
So if you've never had menopause before, you have no idea what it would feel like. And again, even though it's a common journey that all ladies or most ladies will go through, it can be different symptoms for different people.
Yeah.
So some ladies may never have a hot flash. Some ladies may never have any signs of like mood swings, dryness, night sweats. Some of me don't even realize they have went to menopause until they realize they don't get their periods. So it's different for every
Okay.
person. Yeah, so it's different for every person. But again, recognizing the most common symptoms, which are hot flashes,
Mhm.
night sweats, chills, mood swings, vaginal dryness. These are all signs for possible or perimenopausal or menopausal symptoms. So definitely be on the lookout for that.
Okay. So wow. So you mean some people can actually have menopause without knowing that they're in menopause?
Yeah,
They'll live their normal life.
they
There's
will
no
lead their normal life.
wow. It's different from everyone.
It's
So
different for
you
everyone.
cannot
Yeah.
never really compare and say, oh, mine was like this. I believe we should have the same.
Yeah.
No,
Mhm.
So you hear from Dr. Sasu right now. She said people can have it differently. Some might experience it they will have all these symptoms that is displayed. Like she talked about hot flushes, she talked about mood swing, she talked about dryness of the vagina and all of that. So some women might experience that, and some women might not even experience anything. So
Yeah.
if you're experiencing mood swing, yeah, it might be pre-menopause. So check yourself, okay? So we are still waiting for our viewers. If you have any question, please feel free to ask Dr. Patu your questions right now. She's here with me live on Prestigious Talk Show. We are privileged to have her. So please feel free to ask your questions. Okay, please feel free to ask your questions. So we are just quickly go on a few seconds. We are just quickly going to go on a few seconds break. We'll be right back. Dr. Sasu, that is how we do it here, just to keep our viewers going. Yeah.
And watch prestigious talk show.
All right, viewers, welcome back to Prestigious Talk Show. Live here with me on Prestigious Talk Show is Dr. Osasu Asemota, all the way from New York. She's a gynecologist from New York. We are privileged to have her live with us on Prestigious Talk Show. So before we forge ahead with our next question, I would like to ask Dr. Osasu to tell us: does menopause increase the risk of heart disease?
So yeah, so with again the
Really?
steady decrease, yeah, with the decrease of estrogen levels, it has been shown some correlation for elevating our good cholesterol, the LDH,
Mm,
decreasing our, I'm sorry, elevating our bad cholesterol, LDH,
mm,
and decreasing our good cholesterol, the HDL.
mm,
Also, again, estrogen also increases the risk of or decreasing estrogen, I should say, in conjunction with other natural hormones, increases your
mm,
risk of heart strokes, blood clots
mm.
as well. So it's very important to again monitor to see where you are on that phase of life and how to adjust other risk factors if you don't have them arrested already.
Wow. Oh, wow. So I never knew that menopause can increase the risk of heart disease. So what are some of the heart disease that, one can be prone to once one is experiencing menopause?
Yeah, so again it's age in itself. It's an independent
Okay.
risk factor. So
Mhm.
depending on how old you are, when you do have menopause actually is also a separate um risk factor,
Entity.
specifically
Okay.
with heart disease.
Mm-hmm.
Yeah, so for example, someone that was 50 when they got into menopause versus someone who was 45 when they got
Mm-hmm.
into menopause.
Mm-hmm.
The lady that is in her 50s is at an increased risk of having heart disease, which is
Okay.
anywhere from heart attacks, heart strain,
Okay.
pain, or pectorrhea,
Mm-hmm.
or again, if you have like any signs of thrombosis or clogged arteries, those are
Mm-hmm.
one of the risk factors or different forms of heart disease that can be impacted.
Yeah, we have another question from Lazy Drawer. She said, menopause and weight. If you can, does menopause kind of, when you're experiencing menopause, does that mean you have to gain weight or lose weight? Can you tell us about that? She just
Yeah,
said menopause and weight. I'm not sure. Yeah.
yeah. So it's just a change of weight in general.
Yeah.
Most of the time, when we have weight gain.
Yeah.
We have some cases where they had some weight loss.
Mhm.
So maybe
Okay.
because it was most commonly a decrease in their appetite.
Okay.
Mhm.
So most women experience decrease in appetite, which means they will lose weight more.
Right.
Yeah,
Exactly.
but some people actually they'll gain weight for not
Yeah. Most
so
most ladies gain weight.
so it varies though. It's not really something that is one particular weight, either weight gain or weight loss. So
Right.
depends on you, right?
Right.
Okay. So, viewers, if you have any more questions, please, 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 we have Dr. Sasu live here with us because our question, I'm almost running out of my questions. So, please, if you have any question, please feel free to ask her your question right now about your body because she's going to educate us. She's going to be helping us. She's going to give us some tips on how to care for ourselves as women and yeah, Dr. Sasso, I know this is not part of the question that I asked you before. Can you, because I now, we have most young women who have not even given birth. They are not
Mhm.
married. They have fibroid. What is the cause of that? They are young, but
Yeah.
yet they have fibroid. Yeah,
So fibroids is one of the most common
yeah,
disorders in the world. Really, almost 80% of women have fibroids and may or may not know it.
yes.
Um, Fibroid essentially is like a smooth muscle tumor that typically grows in the muscle layer of the uterus.
Mm-hmm,
And it can cause, of course, abnormal bleeding, sometimes pelvic pain, depending on the size and location.
mm-hmm,
But there's no, there hasn't been any direct etiology or direct cause of fibroids, but we
mm-hmm,
do know it responds to the estrogens in our bodies. So specifically, of course, in our food system, there's been a lot of hormonal pumping,
mm-hmm.
corn, different milks, cheeses that are hormone pumped. and it's or given soy, for example, and which is high in estrogen, and that and in our diet, because it's metabolized and incorporated in our bodies, it feeds off of there's some speculation that due to our food supply that there's actually an increased correlation of or burden of fibroids in the population.
Okay. Thank you very much. I'm just quickly going to take this question from Mr. Ambrose Okoye. Thank you, Mr. Ambrose, for actually asking this question. He said, can the hormonal imbalance cause early menopause?
Well, not necessarily, not necessarily, no. But you can, for example, well, menopause happens when your estrogen levels decrease because your ovaries are no longer being stimulated.
Yeah.
But having, for example, PCOS, or polycystic ovarian syndrome, does not necessarily put you at an increased risk of having early menopause symptoms. It can put you at an increased risk of having abnormal bleeding, which
Okay.
can be one of the symptoms for possible menopause or perimenopause, right? You can have abnormal bleeding before you go into a period, you don't have your period anymore, which is clinically for at least 1 year. But no, there has been studies that suggest any hormonal imbalance may put you at a higher risk for menopause.
Oh, okay. Any hormonal imbalance may put you on high risk, right?
They do not. No, there's no studies that shows any correlation.
Okay. All right. Thank you very much. So I have another question. Somebody actually, some of them are texting me right now. So it's really crazy. I said they should come and comment live. Somebody actually sent me a text message, said, she experienced menopause for 1 year because she went to meet her doctor. She had a pre-menopausal experience. And after 1 year, she didn't see her period complete 1 year. And later, after 1 year, she started seeing her period again. And she freaked out because she thought, she went to her doctor. Doctor thought it was because the doctor told her after 1 year is a full menopause, right?
Right.
So,
Yeah.
but after then, she wasn't sure of what to do. She started experiencing her period, and she had to quickly go see her gynecologist. So, what is the cause of that? She said they said she should carry out so many tests. What can be the cause of that?
Yeah. So the most common cause of
Yeah.
bleeding after after menopause is what we consider vaginal atrophy. So estrogen has they play a lot of different roles in our body. So estrogen is also kind of responsible for like the buoyance and the turgor of of some skin cells. So naturally, again, if that decreases, then your skin cells are going to be more fragile and more delicate. So even daily activities like walking, for example, can cause friction between the skin cells and cause bleeding. So that's the most common reason why some ladies have bleeding after their periods. However, I do encourage all ladies that do experience this to please see a gynecologist. They would always have to rule out, of course, any underlying cancer.
Cancer, yeah.
Which is the most significant and concerning signs for menopausal bleeding. So you always want to go make sure you go to the doctor and make sure that's ruled out and get the appropriate care.
Okay. I have another question here. Now they are sending questions. He said, good, please, people send me your questions. She said, this is from Annalise Joel. She says, some people claim fibroid is common among Black race. How true is that?
Yeah. So again, it's common in general, but yes, African American women are significantly at an increased risk of having or rate of having fibroids compared to specifically the white population.
Oh, really? So in a way, it's true. The statistics has, shown that Black women are more susceptible to having fibroid than their white counterpart, right?
Right.
Okay. Right. So yeah, she said it's in a way true that women, is it the food? Is it because of our gene? Is it because of our race? Why?
No, yeah. So it's a combination of both. So again, there's actually a large number of ladies that have fibroids and we'll never know because it doesn't cause them problems. But for whatever reason, Black ladies tend to be more symptomatic, meaning it causes them more trouble, meaning it causes
Okay.
them pelvic pain, it causes them abnormal bleeding or heavy bleeding or anemia. So it's possible that Black ladies may have more symptoms
Mm-hmm.
compared to the white population, but also may also have an indication of care, right? So white, it's no secret that Black ladies or African American women have a higher time having adequate resources in terms of
Mm-hmm.
their overall health. So they might not even know to start birth control or any other types of treatment
Mm-hmm.
from their fibroids or their overall health compared to their white counterparts.
Okay. Okay, so we are just going to take the last question because this show is going to stream for 1 hour, and I have Dr. Sasu here with me. And yes, if you have your question, please quickly send it. But I have somebody sent me a question about serious menstrual period. She says when she's experiencing her menstrual pain, she can go to work, she can do anything, and it takes a couple of days before she will just feel
Mhm.
normal. What's the cause of all this?
Yeah, no,
Is there any? She just sent me a message. Said, please, can you ask Dr. Sasu? She's been experiencing pain when she's in menstrual pain. Her life is just,
yeah,
she can do anything. She's just limited to,
not bad.
she's confined in her. Everybody will know that she's on her period because she can't go to work.
Mhm.
Yeah, so
Yeah,
that's this excruciating pain when
yeah,
experiencing her
definitely.
period. Yeah.
Yeah, most ladies do have pain with their menses or with their period. Um, in terms of the causes, sometimes it could be a sign of some other reproductive issues such as endometriosis,
Mm.
which is having painful periods, irregular bleeding, and or having any issues with infertility. So I will tell my ladies if they have like extremely life impacting or life altering changes with their periods to see a gynecologist. Maybe they can dive in a little bit more. But one of
Okay.
the most common things I tell my ladies to do over the counter is apply heating pads to their abdomen or the lower back
Hmm.
when they have their periods. Eating yogurt beforehand, before you anticipate your next period will occur, has been shown to decrease your menstrual like pains. And
Okay.
of course, over the counter pain medications such as Tylenol or
Hmm.
Motrin or any NSAIDs have been shown to be really helpful with dealing with the pain.
Okay. Thank you so much. I'll definitely relate this to her. So, our last question. Of course, we'll finish the question. The last question we have for Dr. Sasu, please. What tip can you give to our viewers in terms of how they can better understand their body? What tip
Yeah.
you have to give to our viewers?
Yeah. I would say seek into that curiosity. There's
Mhm.
actually a lot of information online, on the websites in terms of like what to expect, what's normal, what's not normal.
Mhm.
And again, have the conversation or having the relationship with your gynecologist.
Okay.
I feel like oftentimes women they think they just only need to come to the gynecologist or to the doctor itself when something's wrong, but it's
Mhm.
also to know like what is right. That's also going to help you to know when something is really important,
Mhm.
or when something can be pushed back. So I would say just have a conversation with your gynecologist and ask all the questions that you have. Again, every woman's body is different.
It's different.
Um, so what's maybe normal for you may not be so normal for someone else. So
Yes.
definitely ask the questions about your body, what's normal, what's not normal with the gynecologist, and really develop that relationship.
Okay, thank you so much, Dr. Sasu. So, viewers, we've had Dr. Sasu here with us from 1 p.m. It's almost 2. Now she's been with us. Please, let's thank her for coming to Prestigious Talk Show. Thank you so much for coming back to our
Thank
show.
you so
And of
much.
course, this is not the last time. I will definitely invite you again
It was my
because
pleasure.
yes, yes, thank you so, so much because now we have to definitely, educate women about their body. This is why I said people should watch this show. This show is very informative, is knowledgeable, is a space whereby you learn. This is something because most people don't read, they don't like to read. So if
Mhm.
they love to hear it from others, yes, we'll try to bring an expert like you on our show to educate women. So thank you so much, because women's health is in women's hand. We have to take care of
Yes.
ourselves,
Yes.
right? Ourselves.
Absolutely.
Yeah,
Thank you so
we
much
have,
for creating such a platform to ask these
yes,
questions. Absolutely.
yes. Our health is in our hand. We have to care for ourselves mentally and physically. So, and it's also good for us to actually know our body, right? So,
Yeah.
thank you so much for all the tips and for actually educating us. I learned a lot from you today. I
Thank
know
you.
you use a lot of medical terms. Of course, I will search on those. Yeah. So thank you for coming to Prestigious Talk
Thank
Show. I
you.
would like to have you back next time. And
Yes.
viewers, thank you for watching. Please continue to help us share this video. Share this video, and this video might even help one or two persons. It might help your friend, your family member. All we ask you to do is to share this video. Please share this video, not to waste my time or to waste Dr. Osasu time. She gave us her time. Okay, I watched a TikTok video. This is very interesting. This TikTok video, I share it on my page. He said when somebody needs your attention and they give
Mhm.
you their attention, you should cherish it, because their attention means they are giving you their time, and time is life, which means this person gave you their life. Okay, time is associated with life. So for
Yeah.
someone to give you their time, which means they've given you some part of their life. So please, viewers, we want you to share this video, okay, because Dr. Sasu gave us her time, okay. She's here, she's not been paid. We invited her and she honored the invitation. So thank you, Dr. Sasu, once again for coming
My
to.
pleasure. Thank you so much.
So thank you, viewers, for watching. Please share this video and subscribe to our YouTube channel if you want to see people like Dr. Sasu here on our page. And again, I want to remind you, viewers, tomorrow we have a special guest coming to join us live on Prestigious Talk Show. She's coming here to also educate women, especially Black women. Okay, she's the first Black woman to have her own credit card company. She's going to be with us live here on Prestigious Talk
Nice.
tomorrow. Please do not miss out. Make sure you are with me live here tomorrow. She's going to be educating you on how to build your credit and how to have your secure credit. So tomorrow, please join us. I will send out the flyer tonight. Okay. Thank you all for watching. Subscribe to my YouTube channel. Follow us on Facebook. We are on Twitter. We are on Instagram, and we are on we are on Instagram, Twitter, Facebook. Please follow us, and remember, you are not alone. I'll see you tomorrow, because it's tomorrow by special grace of God. I'll see you tomorrow. Thank you for joining. Bye-bye.
Bye.
Bye. Thank you so much, Dr. Sasu.
No
Bye.
problem.
All right.